The alarm screamed at 5:45 a.m. in the small studio apartment in Queens. Dr. Sarah Chen rolled out of bed, her body tired not from physical exhaustion, but from the mental strain of pretending to be someone she wasn't. At 32, she moved through her morning routine with the quiet efficiency of someone who had learned to make herself invisible. As she reached for her navy blue scrubs, her eyes caught the framed diploma hidden face down in her dresser drawer. Harvard Medical School, summa cum laude, class of 2018. Next to it, her Johns Hopkins Surgical Residency Certificate and her board certification in emergency medicine. Documents that had once represented the pinnacle of achievement now felt like artifacts from a different life. Was this the price of her Harvard diploma? The question had haunted her for 18 months, ever since her world had collapsed in a single devastating day. She splashed cold water on her face, avoiding her reflection in the bathroom mirror. The woman staring back wasn't Dr. Sarah Chen, the rising star who had been on track to become one of the youngest trauma surgeons at Johns Hopkins. This was Sarah, the nursing assistant. Sarah who followed orders without question. Sarah who bit her tongue when she watched medical mistakes happen in real time. The irony was suffocating. She was working in the same field where she had once been respected and accomplished, but now as someone whose medical knowledge was considered irrelevant. 18 months ago, everything had changed in the span of a single shift. A patient had died during what should have been a routine surgery, not because of her surgical skills, but because of a drug interaction that the anesthesiologist had missed. Sarah had caught the error and tried to intervene, but it was too late. The family sued everyone involved, including her. The hospital, facing public scrutiny, needed scapegoats. While the case made its way through the courts, her medical license was suspended pending investigation. Her malpractice insurance premiums skyrocketed. The legal bills mounted. Without the ability to practice medicine, she had bills to pay and student loans that didn't care about her suspended license. That's how Dr. Sarah Chen, Harvard-trained physician, became Sarah the nursing assistant at Memorial Hospital in Manhattan. "At least you're still in healthcare," her mother would say during their weekly phone calls, her voice carefully neutral. But Sarah could hear the confusion her family felt. They had sacrificed everything to help her achieve her dreams, and now she was essentially playing nurse, while real nurses with associate degrees earned more than she did. She pulled on her scrubs, the fabric feeling like a costume that never quite fit right. The hospital ID badge clipped to her pocket read, "Sarah Chen, nursing assistant," with no mention of her medical degree or surgical training. To everyone at Memorial Hospital, she was just another healthcare worker, competent, but not someone whose medical opinions mattered. The commute to Manhattan took 45 minutes on 2 different subway lines. Sarah used the time to read medical journals on her phone, keeping up with advances in trauma surgery and emergency medicine. Other passengers, nurses heading to their shifts, medical residents studying for exams, sometimes noticed what she was reading and looked confused. Why would a nursing assistant be reading about advanced surgical techniques? She had learned to keep her medical knowledge hidden. The few times she had offered clinical insights or caught diagnostic errors, she had been politely but firmly reminded to stay in her lane and let the doctors handle medical decisions. Memorial Hospital's emergency department was a controlled chaos of humanity at its most vulnerable. As a Level 1 trauma center in Manhattan, it saw everything from heart attacks to gunshot wounds to multi-car accident victims. Sarah had been working there for 8 months, officially assisting nurses but actually functioning far below her capabilities. She arrived at 7 a.m. for the day shift, walking through the automatic doors into the familiar smell of antiseptic and the constant hum of life-saving equipment. The ED was already busy with overnight cases, and the incoming shift was preparing for what promised to be another demanding day. "Sarah," called out charge nurse Jennifer Walsh, a 20-year veteran who ran the ED with military precision. "I need you with Dr. Rodriguez in Trauma Bay 3. We've got a motorcycle accident coming in, ETA 5 minutes. Dr. Miguel Rodriguez was a second-year emergency medicine resident, technically competent but still learning to manage high-stress situations. Sarah had watched him work for months, noting his strengths and his tendency to overlook certain diagnostic possibilities when under pressure. As they prepared the trauma bay, checking equipment and arranging supplies, Sarah found herself mentally running through motorcycle accident protocols, airway management, spine stabilization, internal bleeding assessment. It was automatic, like muscle memory from her residency days. "Have you worked trauma before?" Dr. Rodriguez asked, noticing her efficiency with the equipment setup. "A little," Sarah replied carefully. It was technically true. Her surgical residency had included extensive trauma rotations, and she had managed countless critical cases, but explaining that would raise questions she wasn't prepared to answer. The ambulance arrived with sirens wailing. The paramedics wheeled in a 28-year-old male cyclist who had been hit by a delivery truck. Multiple injuries were obvious: compound fracture of the left leg, possible internal bleeding, head trauma, and difficulty breathing. Dr. Rodriguez took charge, his voice steady, but Sarah could see the stress in his movements. "Let's get him on the monitors. I need a chest X-ray, CBC, basic metabolic panel, and type and cross for 4 units. As the trauma team worked, Sarah positioned herself where she could observe and assist without getting in the way. Years of surgical training had taught her to assess patients quickly and comprehensively. Within seconds, she had noted several concerning signs that Dr. Rodriguez hadn't mentioned. The patient's breathing pattern suggested a possible pneumothorax, his abdominal rigidity indicated probable internal bleeding, and his pupil responses were inconsistent with a simple concussion. "Blood pressure dropping," announced the nurse monitoring vitals. 90/60 and falling. Dr. Rodriguez ordered fluids and called for a CT scan, standard protocol for trauma patients. But Sarah could see something that worried her more. The patient's neck veins were becoming distended, and his breathing was becoming more labored. Classic signs of a tension pneumothorax, a life-threatening condition that required immediate intervention. She watched as Dr. Rodriguez focused on the obvious injuries, managing them competently, but missing the subtle signs of the more dangerous problem developing. The patient's oxygen saturation was dropping despite supplemental oxygen, and his blood pressure continued to fall. Sarah found herself in an impossible position. She could see exactly what was wrong and knew exactly how to fix it, but she was officially just a nursing assistant. Speaking up would mean revealing knowledge that she wasn't supposed to have. The patient's condition deteriorated further. His lips were turning blue despite the oxygen mask, and the monitors showed his heart rate climbing dangerously high. "Dr. Rodriguez," Sarah said quietly, moving closer to him, his breathing pattern and neck vein distension. "I've got this," he replied curtly, not looking up from the computer where he was ordering additional tests. "Just keep monitoring his vitals." Sarah watched in growing alarm as the patient showed all the classic signs of impending cardiovascular collapse. In minutes, he would go into cardiac arrest if the pressure building in his chest wasn't relieved immediately. The monitors began alarming as the patient's vital signs crashed. His blood pressure dropped to 70/40, his heart rate spiked to 140, and his oxygen saturation plummeted despite maximum oxygen support. "He's crashing," Dr. Rodriguez called out, the stress evident in his voice. "Get respiratory therapy down here now." Sarah could see the problem clearly. A tension pneumothorax was compressing the patient's heart and major blood vessels, preventing blood from returning to his heart. It was a classic emergency that required immediate decompression, not more oxygen or breathing treatments. The respiratory therapist arrived and began adjusting ventilator settings, but Sarah knew it wouldn't help. The problem wasn't with the patient's lungs' ability to process oxygen, it was that air trapped in his chest cavity was literally crushing his heart. "Blood pressure 60/30, announced the monitoring nurse, her voice tight with concern. Dr. Rodriguez was ordering emergency medications and preparing for intubation, but Sarah realized he still hadn't recognized the underlying problem. The patient was going to die from a condition that could be fixed in 30 seconds with the right intervention. She looked around the trauma bay. 3 other medical residents had arrived to help, along with a nursing supervisor and additional technical staff. Everyone was focused on following Dr. Rodriguez's orders, implementing standard resuscitation protocols that wouldn't address the real problem. The patient's heart rate climbed to 160, his skin was turning gray. The monitors showed the characteristic pattern of impending cardiac arrest. Sarah made a decision that would change everything. "Dr. Rodriguez," she said firmly, stepping directly into his line of sight, "this patient has a tension pneumothorax. He needs immediate needle decompression, or he's going to arrest in the next 60 seconds. The trauma bay fell silent except for the alarming monitors. Dr. Rodriguez stared at her, shocked that a nursing assistant would make such a specific diagnostic statement and treatment recommendation. "What did you say?" he asked. "Tension pneumothorax," Sarah repeated, her voice steady despite the adrenaline coursing through her system. "Look at his neck veins. They're distended. His breathing is asymmetrical. His blood pressure is dropping because venous return to his heart is compromised. He needs a 14-gauge needle in the second intercostal space, mid-clavicular line, right side." The specificity of her diagnosis and treatment plan left the room stunned. This wasn't general medical knowledge. This was advanced emergency medicine being delivered by someone wearing a nursing assistant's badge. "Who are you?" Dr. Rodriguez asked quietly. Before Sarah could answer, the patient's heart rhythm changed on the monitor. The fast, regular heartbeat was becoming irregular and weak. He was seconds away from cardiac arrest. "There's no time," Sarah said urgently. "If you don't decompress his chest right now, he's gonna die." Dr. Rodriguez looked at the monitors, then at the patient, then back at Sarah. The clinical picture she had described was exactly what he was seeing, but he had been too overwhelmed by the multiple injuries to recognize the pattern. "Get me a 14-gauge needle and prep the right chest," he ordered. As the nurse prepared the equipment, Dr. Rodriguez looked directly at Sarah. Where exactly? Sarah knew she was crossing a line from which there was no return, but the patient's life hung in the balance. "Second intercostal space, just medial to the mid-clavicular line," she said, pointing to the exact spot on the patient's chest. "You'll know you're in the right place when you hear the air rush out." Dr. Rodriguez positioned the needle and inserted it into the patient's chest wall. Immediately there was a loud hissing sound as trapped air escaped from the chest cavity. The change was dramatic and immediate. The patient's blood pressure began climbing, his heart rate started normalizing, and his oxygen saturation improved within seconds. The trauma bay erupted in controlled celebration as the monitors showed the patient stabilizing, but all eyes turned to Sarah, the nursing assistant who had just demonstrated medical knowledge that no nursing assistant should possess. As the patient was stabilized and prepared for surgery to repair his other injuries, Dr. Rodriguez pulled Sarah aside into a quiet corner of the ED. "I need to know who you are," he said quietly. "What you just did, that wasn't nursing assistant knowledge. That was physician-level diagnostic and treatment planning." Sarah felt 18 months of carefully maintained facades crumbling around her. She had saved a life, but in doing so she had revealed herself completely. "My name is Dr. Sarah Chen," she said quietly. "I graduated summa cum laude from Harvard Medical School in 2018. I completed my surgical residency at Johns Hopkins and was board certified in emergency medicine." Dr. Rodriguez stared at her in disbelief. "You're a doctor. What are you doing working as a nursing assistant?" The question she had been dreading for 18 months hung in the air between them. Sarah took a deep breath and began the explanation she had never wanted to give. 18 months ago, I was a trauma surgeon at Johns Hopkins. During what should have been a routine surgery, there was a drug interaction that the anesthesiology team missed. I caught it and tried to intervene, but the patient died. The family sued everyone involved, including me. Dr. Rodriguez listened without interrupting as Sarah continued. "While the malpractice case worked its way through the courts, my medical license was suspended pending investigation. I couldn't practice medicine, but I still had student loans and rent to pay. The only healthcare job I could get without an active license was as a nursing assistant. But why didn't you tell anyone here that you're a doctor?" Sarah's expression darkened. "Because I tried that at my first job after the suspension. As soon as they learned about the malpractice case, even though it wasn't my fault, I was labeled as damaged goods. No one wanted to take the risk of having me around, even in a reduced capacity. I learned to keep my background hidden." The weight of her story settled over them both. Dr. Rodriguez was looking at her with a mixture of respect and sympathy, trying to process the idea that he had been working alongside a Harvard-trained physician who had been forced to hide her expertise. "The patient you just saved," he said slowly. "He would have died if you hadn't spoken up." "I know," Sarah replied simply. "That's why I couldn't stay silent anymore." Their conversation was interrupted by the arrival of Dr. Elizabeth Harper, the emergency department director. She had heard about the dramatic save in Trauma Bay 3 and wanted to understand exactly what had happened. "Dr. Rodriguez," she said briskly, "I understand there was some unusual diagnostic work involved in the motorcycle accident case. Can you walk me through what happened?" Dr. Rodriguez glanced at Sarah, then made a decision that would change both of their lives. "Dr. Harper, I'd like you to meet Dr. Sarah Chen. She's the one who diagnosed the tension pneumothorax that I missed. Without her intervention, the patient would have died." Dr. Harper looked confused. "Dr. Chen, I don't have any Dr. Chen on my staff roster. That's because she's been working here as a nursing assistant for the past 8 months, Dr. Rodriguez explained. "She's a Harvard Medical School graduate and board-certified emergency physician." The revelation hit Dr. Harper like a physical blow. She stared at Sarah, trying to reconcile the woman in nursing assistant scrubs with the credentials Dr. Rodriguez had just described. "Is this true?" she asked Sarah directly. "Yes, ma'am," Sarah replied. "I graduated from Harvard Medical in 2018 and completed my emergency medicine residency at Johns Hopkins. My license is currently suspended pending resolution of a malpractice case, but the suspension doesn't prevent me from working in healthcare in a non-physician capacity." Dr. Harper was quiet for a long moment, processing the implications. Then she asked the question that would determine Sarah's future. "Dr. Chen, are you willing to tell me the full story?" In Dr. Harper's office an hour later, Sarah told her complete story for the first time since the nightmare had begun. Dr. Harper listened without interruption as Sarah described the patient death, the lawsuit, the license suspension, and the 18 months of working below her capabilities while fighting to clear her name. "The malpractice case was settled 6 months ago," Sarah concluded. "The investigation determined that I had followed proper protocols and that the patient's death was due to an unforeseeable drug interaction. My license was reinstated, but by then, I had been out of active practice for over a year. No hospital wanted to hire someone with a malpractice history, even if I was cleared of wrongdoing. Dr. Harper had been taking notes throughout Sarah's story. When Sarah finished, she set down her pen and looked directly at her. "Dr. Chen, what you did today, recognizing and treating that tension pneumothorax, was excellent emergency medicine. Dr. Rodriguez is a competent resident, but he missed a life-threatening condition that you caught immediately. I've been watching cases like that for months," Sarah admitted. "There have been times when I've seen diagnostic possibilities that weren't being considered, but I've kept quiet because it wasn't my place to speak up. And today you decided it was your place? Today a patient was going to die if someone didn't act. I couldn't live with staying silent when I had the knowledge to save a life." Dr. Harper nodded slowly. "Dr. Chen, I'm going to make you an offer. I need experienced emergency physicians, and you've just demonstrated that your clinical skills are sharp despite being out of active practice. I'm prepared to offer you a position as an attending physician in this department." Sarah felt her heart stop. After 18 months of hiding her medical knowledge and working far below her capabilities, she was being offered the chance to practice medicine again. "But," Dr. Harper continued, "there are conditions. You'll start on probation for 6 months. You'll be closely supervised, and any concerns about your performance will result in immediate termination. Are you willing to accept those terms?" Sarah thought about the morning ritual that had tormented her for 18 months, looking at her hidden Harvard diploma and questioning whether her education had been worth the price she had paid. Today, that diploma would finally mean something again. "Yes," she said simply, "I accept." Word of the nursing assistant who turned out to be a Harvard doctor spread through Memorial Hospital like wildfire. Within days, everyone knew the story of Dr. Sarah Chen, the physician who had been hiding in plain sight while working as a nursing assistant. The reaction was a mixture of amazement, respect, and embarrassment. Several staff members remembered times when Sarah had made observations or suggestions that had seemed unusually insightful for a nursing assistant. Now they understood why. Dr. Rodriguez became one of her strongest advocates. "She saved a life that I would have lost," he told anyone who would listen. "She saw what I missed, and she had the courage to speak up even though it meant revealing everything she had been hiding." But the transformation wasn't without challenges. Some colleagues questioned why Sarah had hidden her credentials for so long. Others wondered if her malpractice history made her a liability. Sarah had to prove herself all over again, this time as a physician returning to practice after a forced hiatus. Her first official shift as Dr. Chen was emotional. Walking into the ED wearing a white coat instead of nursing assistant scrubs felt like stepping into a life she had thought was lost forever. The hospital ID badge that had once read Sarah Chen, nursing assistant, now read Sarah Chen, MD, emergency medicine. The nursing staff who had worked with her for 8 months treated her with a mixture of respect and friendship. They had seen her competence and dedication when she was officially their subordinate, and they were genuinely happy to see her elevated to her proper role. "We always knew there was something different about you," said Jennifer Walsh, the charge nurse who had supervised Sarah for months. "You asked questions and made observations that showed you understood medicine at a deeper level. Now we know why." But it was Dr. Harper who put Sarah's journey into perspective during her first week as an attending physician. "Dr. Chen," she said during a quiet moment in the ED, "what you've been through, the malpractice case, the license suspension, working as a nursing assistant, that experience has made you a better physician. You've seen healthcare from a different perspective. You understand what it's like to have your knowledge dismissed and your expertise ignored. That empathy will make you a better doctor." 6 months later, Dr. Sarah Chen had not only completed her probationary period successfully, but had become one of the most respected physicians in the emergency department. Her unique background, both her medical training and her experience working as a nursing assistant, gave her insights that benefited the entire team. She had an unusual ability to spot potential problems before they became critical, partly because her medical training was excellent, but also because her months of careful observation had taught her to notice subtle changes that others might miss. More importantly, she had become an advocate for better communication between different levels of healthcare workers. She instituted regular briefings where nurses, nursing assistants and technical staff were encouraged to share observations and concerns with physicians. "Everyone in this department has valuable insights," she would tell new residents. "The nursing assistant who's been watching a patient for hours might notice something that a doctor who's been in the room for 5 minutes could miss. We need to listen to each other." Her story had also attracted attention from medical organizations interested in how the healthcare system could better support physicians facing malpractice allegations. Sarah became a speaker at conferences, discussing the need for due process protections that would prevent qualified physicians from being forced out of practice while legal cases were resolved. But perhaps the most significant change was personal. Sarah no longer started each morning questioning whether her Harvard education had been worth the price. Instead, she understood that everything she had experienced, medical school, residency, the malpractice case, the license suspension, and the months working as a nursing assistant, had prepared her for exactly the kind of physician she was meant to be. 2 years after the tension pneumothorax case that had changed everything, Dr. Sarah Chen was called to testify before a medical licensing board hearing. A young physician was facing license suspension due to a malpractice allegation, and Sarah had been asked to speak about the importance of due process in medical licensing decisions. Standing before the board, Sarah thought about her own journey from Harvard Medical School to nursing assistant scrubs to attending physician. The experience had been painful, but it had also been transformative. When I was working as a nursing assistant, she told the board, I learned things about healthcare that medical school never taught me. I learned what it feels like to have your knowledge dismissed because of your job title. I learned to see patients and healthcare from a different perspective. I learned that expertise can be found in unexpected places. She paused, looking at the young physician whose future hung in the balance of the board's decision. This doctor facing allegations deserves the same thing every physician deserves, a fair investigation and the presumption that they acted in good faith. Suspending licenses before investigations are complete doesn't protect patients, it destroys careers and wastes the years of training we've invested in our physicians. After the hearing, Sarah returned to Memorial Hospital, where she was now the Associate Director of Emergency Medicine. Her office walls displayed her Harvard diploma, her board certifications, and a photo from her nursing assistant days, a reminder that every experience had value. That evening, as she finished her shift, she was approached by Maria, a new nursing assistant who had been working in the department for a few weeks. Maria seemed nervous, as if she wanted to say something but wasn't sure she should. Dr. Chen, Maria said hesitantly, I have a master's degree in public health, but I can't find work in my field. I've been thinking about going to medical school, but I'm already 30 years old. Do you think it's too late? Sarah smiled, remembering her own doubts and fears, and the long journey that had brought her to this moment. Maria, she said gently, it's never too late to become who you're meant to be, and sometimes the longest road leads to exactly where you need to end up. As Sarah walked out of the hospital that night, she reflected on the question that had haunted her for 18 months. Was this the price of her Harvard diploma? Now she knew the answer. It hadn't been the price, it had been the preparation. Every challenge, every moment of doubt, every time she had been forced to hide her expertise, had prepared her for the moment when that knowledge would save a life and transform her understanding of what it meant to be a physician. The nursing assistant who had shocked everyone had become the doctor who changed everything, and in the busy emergency department of Memorial Hospital, where lives hung in the balance every day, Dr. Sarah Chen continued to prove that sometimes the most important knowledge comes not just from what you learned in school, but from what you learned when everything fell apart and you had to build yourself back up. The woman who had been forced to hide her Harvard degree had become living proof that resilience, empathy, and clinical excellence could emerge from the most unlikely circumstances. If you enjoyed this story, don't forget to hit the subscribe button and become part of our Everyday Life Stories community. Where are you watching from? Drop a comment below. We love hearing from our amazing viewers around the world.